Bakane ICD is a unique device for use in male urinary incontinence and severe urinary urgency in males. It is an external device that compresses the urethra from outside. Its ratcheting mechanism allows one size to fit all. The device is not affected by water or urine unlike other devices. The device also has an advantage that it does not need to be removed during urination. It is very comfortable to wear and is also very light. It provides high level of satisfaction to patients who are very frustrated with urinary incontinence and with other devices which are very frustrating to use to obtain satisfactory urinary control. The device is also great for patients who have severe urgency and want short-term relief to be able to go to church, restaurants, or visit family who otherwise dread leaving home for fear of wet pants and embarrassment. The device is not for continuous use and should only be used under direction and supervision of the physician. It is necessary for patients to become familiar with the different components of the device. The different components of the device are a strap which is made of plastic, soft lining, elevation in the soft lining, button that is used to push this elevation in the soft lining up to compress the urethra. When this button is pushed again, it depresses the elevation to release the pressure from the urethra. Protective tongue in the soft lining. This prevents penile skin from getting trapped between the gate and the strap. The gate that accepts the strap, elevator tab that helps lock the strap in position and secure the device, the guiding rails which keep the strap in position and help it lock. Device placement for use. It is recommended that a folded 4x4 gauze is placed around the penis as far back as possible. Button B is then pressed to push up the soft elevation that compresses the urethra. Device is then placed around the penis so that the elevation E is on the undersurface of the penis and on the urethra. Position the protective tongue, the gate and the elevator tab over the penis at the top part. Engage the strap in the gate and tighten the device to a comfortable position. It might be necessary to guide the strap through the rails at this point with the opposite forefinger. At this point, extreme care must be exercised when placing the device to prevent trapping of the skin between the gate and the strap. Proper positioning of the protective tongue and placement of the gauze around the penis will prevent this from happening. It is not necessary to make the device very tight. Just gentle pressure is all that is required to prevent urinary leak. If the elevator mechanism is stretched, then the device may not lock securely. In this instance, the strap can be brought out through one of the ridges just before the last rail. This will effectively change the angle and allow the device to be locked securely. It is not necessary to remove the device for urination. Compress the device from sides to create a gap between the elevation and the penis, and this in some instances may allow urination. Once the device is compressed from sides and there is a gap between the elevation and the penis, the button then can be pressed to release the pressure on the urethra, and urination can be completed. If this does not allow adequate space for urination, then it might be necessary to lift the tab up and release the strap and loosen the device so that urination can be accomplished. Once urination is achieved, the device can be secured again by retracing these steps. Compress the device from sides so that there is some gap between the elevation and the penis. Press the button to push up the soft elevation to compress the urethra. Release the compression and tighten the device to comfortable position. Again, it is not necessary to tighten the device too much. At this point, it is important to note that the button B cannot be pressed when elevation is in contact with the penis. This feature prevents the button from getting activated inadvertently, which can result in wet clothes accidentally. Precautions one need to take when using this device. Before any use, it is absolutely necessary that the user becomes familiar with all components of the device, so also the locking and unlocking mechanism, so that the device can be safely and easily removed and reapplied without much difficulty. Before use, consult a physician. Care should be taken to prevent the trapping of the skin between the strap and the gate during the placement, and this can be done by positioning the protective tongue appropriately and placing a gauze around the penis. Do not elevate the elevator tab excessively, otherwise it can damage the locking mechanism. Just very gentle pressure is required to release the strap as demonstrated here, and the device can be easily secured. The device should not be left on for extended periods. It is also necessary to release the device periodically to relieve pressure on the penis for circulation. The device should not be used by patients who are on anticoagulants or taking such medications which thin the blood and can cause easy bruising. If there is any penile deformity, the device should not be used. If there is indication of vascular insufficiency with compromise of blood supply to the penis, again the device is not recommended to be used. If there are any active infections, the device should not be used if the infection is in that local area. The device is also not meant to be used in patients who cannot themselves remove the device and are likely to be left unattended. Properly used Bakane incontinence control device will provide high levels of satisfaction and extended use. The device can be washed with soap and water. UroMend does not accept responsibility for improperly used device. The device is a prescription item and can be obtained by calling UroMend or through your physician.